Okay, now we're going to talk about cirrhosis. And cirrhosis occurs over a number of years. There's extensive scarring in the liver caused by some kind of inflammation, and normal liver tissue is replaced with fibrotic tissue. And anytime an organ becomes fibrotic, it cannot function as it once did. Um, so the causes could be, the most common cause is actually hepatitis C in this country. It could be due to chronic alcohol use disorder. It could be due to chronic biliary obstruction or an infection. It could be caused by right-sided heart failure, which often is because somebody has COPD, or cor pulmonale, which is due to COPD. What that means is right-sided heart failure. So those are some of the reasons somebody can get cirrhosis. So expect people with cirrhosis to have fatigue and weakness, anorexia, which results in weight loss, dyspnea, because of where the liver is in their breathing, abdominal pain and distension, confusion, which I'll go into later, and emotional lability, which means press 1 minute, euphoric the next. Okay, no telling what their mood's going to be like any time of the day. So those are some of the most early findings. Patients with cirrhosis develop portal hypertension. The portal vascular system is a venous system that takes blood from the small intestine and brings it back to the liver for like detoxification. So nutrient rich blood. What happens is over time when the liver becomes fibrotic, there is backup of blood in the portal system and the patient develops what is known as portal hypertension. If you look at this picture here, you can see where the blood is backing up. So, for example, if you start at the top of the stomach here, this is the lower end of the esophagus, your patient can develop esophageal varices. Varices are very weak veins and they can burst, okay? That's why your patient with cirrhosis needs to eat soft food. Um, And then if you look at the spleen here, the blood can back up into the spleen. When blood backs up into the spleen, patients have what's called splenomegaly. When the spleen gets really big, it acts like a Pac-Man and it ends up eating the red blood cells, the white blood cells, and the platelets. So the patient's going to have anemia, leukopenia, and thrombocytopenia. Okay, and then also on the abdomen they'll have something called caput medusae, and it's basically a bunch of veins on the stomach that look like snakes, and I have a picture of that on the next slide. They also develop hemorrhoids which bleed easy, so patients with portal hypertension, you have to worry about them bleeding. And then ascites is another condition that they can get due to portal hypertension. Here are some pictures of patients that have portal hypertension. These pictures demonstrate the physical findings you may see. The first picture is an anterior view of the abdomen, and you can see these snake-like veins. So that's why it's called caput medusae. And then the second picture is a picture of a man with ascites, and it looks like he's pregnant, right? This big pendulous abdomen. And if you know, the arm up here, only a little bit is showing, but the arm is showing muscle wasting. So it's typical for people with cirrhosis to have this big, huge belly, but yet their limbs are very thin because, due to muscle wasting. The bottom two pictures are pictures of bruising and purpura. And I talked in the previous slide how when the spleen gets really big, it starts eating thrombocytes. So that's one reason people with liver failure bleed. But the other reason is the liver manufactures coagulation factors. So if the liver is unable to do that anymore, the patient is going to be at high risk for bleeding. And their coagulation studies, the PT is going to be prolonged. So they'll need to have some vitamin K, or they may need fresh frozen plasma if they're bleeding. Ascites can be quite uncomfortable. If you remember when you were pregnant at the end, for those of you that have children, it was hard to breathe, right? Especially laying flat. Because of where the ascites is, they're also going to be prone to left pleural effusion, just like when I talked about in pancreatitis. So same signs and symptoms. To keep them comfortable, you can put them in, I call this the banana position. My daughter is a neuro ICU nurse and she calls it the taco position. So whichever one you like. Head of bed 30 with the feet elevated to help promote some draining of the edema in the legs, but also to help relieve their breathing difficulty. Measure the abdominal girth daily to see if the ascites is getting larger. Daily weights are a must to see if they're putting on fluid. And then low sodium diet to try to decrease ascites, and diuretics. And please make sure you're checking the electrolytes if they're on diuretics, and the BUN and creatinine, because at the end stage they will also develop renal disease. Paracentesis is a bedside procedure that can be done to relieve respiratory effort. So in other words, they take off fluid to reduce the ascites so that the patient can breathe better. Another reason they may want to do it is if they suspect that the patient has spontaneous bacterial peritonitis, which can happen because the liver, if you remember, synthesizes proteins, and one of those proteins are globulins, which help us with immunity and fighting infection. Also, because of the splenomegaly, the whites counts may be low, so the patient is going to be at risk for infection. Before the procedure, make sure the consent's on the chart, witness that. Weigh the patient before and after the procedure because you want to know if they lost weight. They should lose weight because usually they take off a large amount of fluid. You want the patient to void before, and that is to prevent the bladder from getting punctured. You want to put the patient supine with the head of bed elevated. That's the positioning for this procedure. And then you want to remember the sequence of post-procedural vital signs. What you're looking for is hypovolemic shock because you just took a lot of fluid off the patient, right? So look for tachycardia, thirst, hypotension, dizziness, parlor diaphoresis. And if the patient does show signs of hypovolemic shock, and it is, sometimes there's not a drainage bag, okay? So the provider will just go in and pull off the fluid and put a Band-Aid over the needle site, right? But sometimes they do put in a drain, so the patient might eventually be able to go home with the drain if they're really end stage, like hospice stage, and then that way they can relieve it themselves at home by putting the drainage bag down and undoing the clamp, okay? Monitor for peritonitis, so remember fever, high white count, guarding, abdominal pain, and rigid abdomen after the procedure for 48 hours. Patients with cirrhosis are at high risk for esophageal varices bleeding. All patients with cirrhosis should be screened for varices because it's much better to try to prevent them than have to deal with them when they're bleeding. All patients with varices will be put on a non-selective beta blocker to hopefully stop the varices from bleeding. There are two medications that the patients can get to stop the bleeding or slow down the bleeding. One is octreotide, and that is good for every patient. And the other one is vasopressin, which you cannot give to people with cardiac issues. They will go to endoscopy, like say they come to your ED and they have bleeding varices. First thing you're going to do, make sure you suction that airway, have the suction ready to go. They're going to need endoscopy to either sclerose or ligate. That's not important. That it'll stop the bleeding. They may need a balloon tamponade, NG2, but I'm going to show you that in another slide. They'll need blood products like packed red blood cells, FFP, fresh frozen plasma, has all the clotting factors. So it's a good blood product to give in people with cirrhosis because their blood clotting factors are going to be low as it is. And then platelets. Monitor the respiratory and the neurological system. Listen, when people have bleeding varices, the blood travels into the stomach and is digested as protein. So when this happens, the patient is going to be at risk for portal systemic encephalopathy because that occurs because the liver can't break down protein, or in other words, it can't detoxify ammonia in the blood. So that's what you're looking for, symptoms of portal systemic encephalopathy if patients swallowed a lot of blood, and they'll have an increased BUN. This is a picture of a Sensaken Blakemore tube. It's used as a balloon tamponade when somebody has varices. It's not used very much anymore, but it's dangerous, so I'm just going to talk about a few things. You always need to stay with your patient when you have this inflated. It can only be inflated for 12 hours. It can migrate up and occlude the airway, so you need to keep scissors in the room, okay? Because if they start to have respiratory distress, you're going to have to cut this and pull it out, okay? So that the balloon will deflate if you cut it. So just remember that. Portal hypertension also results in something called portal systemic encephalopathy. So it's hepatic encephalopathy, that's another name it's called, or PSE. And why this occurs is because, remember, the portal system takes blood from the GI system and all the nutrients and brings it back to the liver to detoxify. Well, guess what? The liver can no longer detoxify protein or break it down anymore. So what happens is it increases ammonia levels in the blood. And ammonia is neurotoxic. So your patient's going to be lethargic. They're going to have something called asteristics, and that is called liver flap. It's flapping of the wrists. They will have slurred speech. People sometimes think they're still drinking and they're not. Early sign is reversal of a sleep-wake cycle. So they're up all night and sleep all day and they don't work nights. Loss of concentration, like people that enjoy crossword puzzles suddenly can't enjoy them anymore. Positive Babinski's, that means when they elicit the Babinski's that the toes don't flex forward, they extend backwards. Okay, so that's a positive Babinski's. You should only see that in babies. They develop peripheral neuropathy, so they're going to have numbness and tinglings in their feet and possibly their hands, so that could be a fall risk. And fetor. Fetor breath is musky, bad breath that is caused by PSE. So it's caused by ammonia in the blood. Lactulose is a medication. It's like a syrupy liquid that is given to facilitate the excretion of ammonia and help alleviate the symptoms of portal systemic encephalopathy. So it decreases the pH of the bowel, which decreases ammonia production. The goal is to have 2 to 3 soft BMs per day, and then your symptoms should improve, like a patient that with a reversal of um, sleep-awake schedule will now sleep through the night, or somebody who had difficulty concentrating will now start to concentrate. They'll be a little bit clearer in the head after this. And it's really important to monitor for signs of encephalopathy because there's like 4 different stages. And you don't need to know the different stages, but I just want to point out, like, if somebody's in stage 4, you can give them lactulose, get the ammonia level down, and they could be back in stage 2. So it's really important to monitor for those signs and get the order for lactulose if needed. One effect is from cirrhosis is the liver cannot break down hormones such as estrogen. So because of the increased estrogen in the bloodstream, people with cirrhosis can have spider angiomas, and this is a picture of a spider angioma. See how it looks like a little spider? Some people call them like burst capillaries, so that can be prevalent. The male pubic hair changes from a diamond shape to more of a triangle shape, which is more in line with the female body. They'll suffer from something called palmar erythema, and that means their palms are going to be warm and red. They're going to have impotence, males, and both males and females can have infertility, testicular atrophy. Males can have gynecomastia, and muscle wasting is common in cirrhosis. and a loss of body hair is also noted due to the effects of estrogen. Here are the expected laboratory findings for somebody with cirrhosis. So the ALT is going to be high, the AST could be high, the ALP will be high if there's biliary obstruction. The ALT and the AST will be high initially, but as the liver starts to fibrose, it no longer can produce those enzymes. So it may be just normal or low at end stage. Bilirubin's going to be high. Ammonia level will be high. That's why we give the lactulose to get that down and put them on a low protein diet. PT will be prolonged. If the PT is prolonged and the patient is bleeding, they're going to need vitamin K and FFP, fresh frozen plasma. Has all the clotting factors. You're going to give it as soon as it comes because it's frozen and there's only a short amount of time that if you don't use it, the clotting factors are going to get used up. So it needs to go in immediately when you get it. Protein is going to be low. Albumin will always be low. And it's one of the factors in ascites, the low albumin. Platelets will be low. Hemoglobin will be low. Glucose could be high or low. And WBCs will be low. In terms of nursing care with skin and hygiene, make sure you clip or file the nails because they're going to have intense pruritus and they really do scratch very deep. Put lotion on their skin. Make sure you're only using tepid water and don't use strong bacterial soap. Then pat their skin dry. Don't rub it to dry it. Use moisturizing creams. You can put cotton gloves on them to kind of prevent them from scratching themselves in long sleeves. They're going to need a soft toothbrush and remember all the bleeding precautions because people with cirrhosis are at high risk for bleeding. So electric shaver, nothing PR, all those precautions. Okay, monitor for petechiae and ecchymosis. Patient teaching regarding the diet in cirrhosis involves if they're on a low sodium diet, you'll have to teach them about that, and that's usually prescribed if ascites is excessive. If they're on a low protein diet from PSE, you'll have to counsel them about eating low protein foods. They need soft foods if they have esophageal varices because if they eat like let's just say chips, potato chips, I just ate some, but they can be a little hard, and as they're going through the esophagus, they might bust one of those varices. So that's why they need to eat soft food. Small, frequent, well-balanced meals, vitamins, fat soluble and B vitamins, especially thiamine. Thiamine prevents a condition called Wernicke's encephalopathy, and it's due to a lack of thiamine. And we'll talk about that a little bit more at the end of the semester when we talk about substance abuse. Fluid restriction for ascites and no alcohol. Here's a pictorial. Spend some time looking through it and see if you remember the reasons why these patients have these signs and symptoms.